How common are unintended pregnancies in the US, and what impacts do they have on maternal and infant health? This question isn't just idle curiosity, it's a pressing issue in our healthcare system. Unintended pregnancies are a prevalent occurrence, with far-reaching implications for both mother and child. Despite this, we've been grappling with a gap in our knowledge. Specific estimates of these associations in our current population have been elusive. The researchers' aim with this research is to bridge this gap. They set out to evaluate the associations of unintended pregnancies with maternal and infant health outcomes. They wanted those relevant to our current clinical practice and public health landscape, those that could provide insights applicable to today's society, to today's women, to today's babies. To gather their data, they turned to a wide array of sources. These included the Cochrane Central Register of Controlled Trials and database of systematic reviews, PsycInfo, SOSIndex, and Medline databases. They didn't stop there though. They also conducted a manual review of reference lists, ensuring they left no stone unturned in their quest for understanding. They sought out epidemiologic studies, those that examined the health of specific populations, specifically the US population. They compared key maternal and infant health outcomes for unintended versus intended pregnancies. Their eligibility criteria were stringent, with each study undergoing an independent dual review of abstracts and full-text articles by their investigators. The process was meticulous, involving data extraction and synthesis from publications concerning study methods, participant characteristics, settings, pregnancy intention, comparators, confounders, and outcomes. Each piece of data was validated by a second investigator. The risk of bias was independently dual, rated by investigators using criteria developed by the U.S. Preventive Services Task Force. The outcomes and measures they focused on included prenatal depression, postpartum depression, the maternal experience of interpersonal violence, preterm birth, and infant low birth weight. As we delve into the research findings, bear in mind the significance of this study in shaping our understanding of the impacts of unintended pregnancies. What did the studies reveal about the relationships between unintended pregnancies and health outcomes for mothers and infants? Let's delve deeper into the findings and their implications. The studies examined several maternal and infant health outcomes with some striking results. Key outcomes included prenatal depression, postpartum depression, the maternal experience of interpersonal violence, preterm birth, and infant low birth weight. When it came to prenatal depression, the data showed that unintended pregnancies were significantly associated with higher odds. Nearly 1 in 4 women with an unintended pregnancy experienced prenatal depression, compared to roughly 1 in 7 who intended to become pregnant. Similarly, postpartum depression was more prevalent in women with unintended pregnancies, affecting about 16% of these women compared to less than 10% among those with planned pregnancies. In terms of interpersonal violence, the association was even more alarming. Women with unintended pregnancies were more than twice as likely to experience such violence compared to those with intended pregnancies. Preterm birth and infant low birth weight, 2 major risks for infant health, also had higher odds in cases of unintended pregnancy. However, it's important to note that these studies do have limitations. For instance, there was limited socio-demographic data available, and the methods used to measure confounders and outcomes varied. These factors could potentially influence the accuracy of the associations observed. Despite these limitations, the significant associations between unintended pregnancy and adverse health outcomes are clear. This highlights the importance of preventive measures and supportive care for women with unintended pregnancies. The risks for both maternal and infant health are substantial, and these women and their infants may require additional resources and support to navigate these challenges. These findings underscore the need for preventive measures and support for women with unintended pregnancies given the associated risks for both maternal and infant health.